Autopsy doctors of Reddit, what's the most interesting thing in a body you've seen? I did the cadaver lab in college and apparently pacemakers continue to go off long after the patient has died. The defibrillator wires have been cut so it can no longer shock the body, but the pacemaker will continue to beep every so often to alert us that the heart isn't beating. When I was a med student, our cadaver had a thumb-sized lump in his scrotum. I thought we'd discover a tumor. When I dissected and cut open the scrotum, there was a plastic object. It turned out to be a penile implant. Our professor had me dissect the entire implant out and everyone else went to our table and I had to show them the entire contraption. Reservoir, cylinders and all. I was later called the penile implant guy. No, I didn't become a urologist. I had to watch an autopsy in med school and the pathologist started removing the organs of a female in her mid-30s. In the middle of it, he said, "I bet she died of sepsis." He then removed a tampon from her vagina and simply said, "The doc is definitely gonna get sued." Taught me that every female in her reproductive years who is septic needs a pelvic exam. Just called my mother to ask her. This was her answer. After 7,000 bodies they all blur together. Probably all the penises. There are an amazing range of dongs out there. Plus, a lot of the tribal Africans have penis tattoos. One that sticks out. P. said, "Treat me nice." Plus, you know, all the stabbings and machete hackings. Thanks, mum. This Justin, Art's mom has handled over 7,000 dongs. Not me, but a golf friend of my dad. The guy came to the golf course one weekend and apologized for not being his usual joking self. He had just attended an autopsy of a 16-year-old girl who committed suicide and he was depressed about the whole deal. He told my dad the girl had ingested pills, booze, but prior had literally taken great pains to be the most beautiful corpse she could. Immaculately dressed up, did her toenails, fingernails with sparkly polish, full face of makeup, washed, curled hair, perfumed, fancy party dress, lace undies, that you could tell she took great effort to go out as a beautiful corpse. I used to cut corneas, blood vessels, heart valves, tendons, and bones out of the deceased for transplants, so I went to the medical examiners almost daily, saw all sorts of crazy things. Saw the guy that went through a road chipper, the giant machine that chews up old roads. Largest piece of him was baseball sized. Saw a cannon to the face point blank. Dogs chewing off the faces of their dead owners. I could go on and on. Take pride in your work. Stop cutting corneas. Grad student in physical therapy. We did cadaver lab over the summer. Sort of the same thing, right? But made all the incisions and dissections ourselves in small groups. When we got to the chest cavity, significant chunks of our fellow's right lung were liquefied. He was a long-term smoker who died from other problems going on elsewhere in his body, but I'll never forget having to scoop brown coagulated jelly out of the chest cavity with my hands and a turkey baster. Don't smoke, kids. Our professor told us it was probably a lung bleb that we popped when we cut the ribs. I'm nowhere near a respiratory therapist, plural surgeon or oncologist, so maybe someone else can enlighten us further. A bleb is an actual medical term to describe a blister filled with fluid. They can happen on organs. Most commonly, as an embalmer, I see them on skin as a result of edema, but lungs are totally viable. My old forensics professor used to be a coroner, either that or pathologist. He had permission from the families to show us slides from scenes autopsies in our classes. One that stayed with me was a gentleman who committed suicide and tattooed a Y incision down his chest with "Dear Coroner, be gentle" tattooed down it. I legitimately want to have this done now, just to give whoever cuts me up something to laugh about. Medical student. In my anatomy class we each got a body to dissect. I got an elderly woman who died of cancer, so I spent a lot of time looking at metastasis in and around her lungs. When checking her now empty chest cavity, I found a piece of thick, coarse blue string around one of her ribs, like a thin piece of nylon rope. Presented it to the conservator. He had no idea how it could have gotten there during the embalming process, and she had no recent scars on her chest. Some of her previous doctors were not on top of their game. As someone who has probably spent over 2 days under the knife in total, this doesn't make me feel better. Mom, here, worked in an operating room for 20 years. Top 3 were: one gentleman who was asleep on the table but we had to wake him up because his penis was so long that the instruments would not allow us to get to his bladder. We had to special order instruments and bring him back another day. 2 was a guy with a huge bladder stone. Turns out that it was a blue lapis bead that he stuck up there and a stone formed around it much like a pearl in an oyster. The urologist chopped up the stone in his bladder and then called us in to see the bright blue bead before he removed it. 3 was a Russian sailor brought in with a vibrator way in his intestines. He had to have his belly cut open to remove it. This was in the middle of the night and apparently he was with his boyfriend when this happened. Meanwhile his wife was in the waiting room and clueless to what happened. I think the surgeon told her a story. Once upon a time your husband was totally gay. The end. Not an autopsy doctor but a medical student that did a rotation in autopsy pathology back when I thought that is what I wanted to do. 1. Penis pump. Was not quite expecting it and it took me a moment to figure out what was going on down there. 2. Cancer in people who died of unrelated causes. One that stands out is an otherwise healthy 40-something who died in an MVA who had a giant breast mass with metastasis to the brain. The breast mass was obvious just by looking at the breast. Donor was obvious she was either in denial or hiding it for other reasons. I work in a wildlife pathology lab, so we do a lot of necropsies, mostly marine mammals. One of the things that always impresses me is what these animals can survive, with no medical intervention. I had a young sea otter pup come in, probably 2-3 months old, and when I got to the chest, I still hadn't determined COD. It was a little thin, but everything else looked okay. Once I opened the chest and removed the heart and lungs, there was a bullet just sitting in the chest cavity. There was a small, scarred defect in the chest wall that must have been an entry, but no hemorrhage, no remaining evidence of an entry through the skin, and just a small amount of fluid in the chest, probably an artifact of freezing and thawing. This animal had survived the initial gunshot wound for at least several weeks. Other than that, cancers are always really interesting. I feel like humans could go through quite a bit but the pain isn't worth it. Animals have no other choice. I used to cut up dead bodies for use in scientific research facilities. 1. Penis pump. You pumped it up by squeezing a fake testicle. 2. Maggots. Tons of maggots. 3. Horseshoe kidneys. They had one giant kidney, shaped like a horseshoe. 4. Metal piping. Seriously, the body had been decomposed so all we could procure were the arms and lower legs. Cremated the rest and when we pulled out the ashes we found metal piping. 5. Surgery tools. More than a few times. 6. The one that surprised us the most was actually breast implants. When they were really well done we had no clue until we started cutting. Sometimes the person had been too embarrassed to tell us before they deceased. Wife's school had a trophy case of unusual findings. The one that sticks with me looked like a medicine ball with baseball-like stitching crisscrossing it. Was told it was a gigantic ovarian cyst. Pretty gross. Also her lab partner tried to bounce the brain they dissected off his knee like a soccer ball and ended up splitting the hemispheres in two. He was a tool. I used to teach anatomy to med students. I'm generally very calm and approachable, but any student doing that in my lab would have been yelled at so much he'd wish he were on the table instead of the cadaver. Medical student. May not be the coolest thing here, but my donor had a third kidney, and that's how I found out that the diseased kidneys aren't necessarily removed during kidney transplants. I am a type 1 diabetic of 15 years, and I have 3 fully functioning kidneys. What cruel irony. I'm not a pathologist, but my job does require me to attend autopsies on a regular basis. I've seen about 5 gangrenous crotches in as many years. Hands down, I would rather attend a decomp autopsy than a crotch rot one. Never seen any dead gangrenous crotches, but living ones I have seen. I got to spend some time in an advanced wound care center where a couple of folks were being treated for Fernie's gangrene. Gangrene of the anus, perineum and genitalia. It was pretty nasty stuff. One guy had his scrotum filleted open and had his testicles free hanging. Do necropsies count? If so, here are 2. The dog who died from swallowing a kitchen knife. A big one. It looked pretty messy in there. The cow who had eaten a piece of wire that pierced through its stomach wall and proceeded to enter its thorax and stab the heart, which strangely enough did not kill the cow, but resulted in a pericardial infection that did. One time I found this strange oval-shaped magnet in a field. Someone told me it's a magnet that is fed to cows to collect any random bits of metal they might eat, so it doesn't go tearing through their entire system. Not sure if that would have helped the cow you're talking about at all. Not a doctor but an embalmer, so I've seen my fair share of posted cases over the years. Last week I completed an embalming of a man in his early 40s who died of atherosclerosis. His entire thoracic cavity was lined with fatty tissue deposits along the inside of his rib cage, all filigreed along his intestines. It was strange. I also embalmed a 1-year-old who had been posted a couple of years ago. The fontanelles of his skull weren't yet sutured together and the calvarium was translucent like stained glass. Dealing with death like you do, not for me. I see your clients first as a firefighter. How you do that job is one thing. How you deal with children, no effing way. Respect to you and those in your line of work. I am a university student doing a module on forensic anthropology. Just the other day in a practical my lecturer showed me a skull of a man from the 1600s. He has the nickname Trauma Man and I think he is my hero. This guy suffered blunt force trauma to the head and lived. Then he suffered sharp force trauma to the head which cut out some of the occipital region of his skull and survived. Then he suffered projectile force trauma which could only be identified as a crossbow bolt to the head. And guess what? He survived. Later on 2-3 weeks estimate he suffered an infection within his skull which went on to be the cause of his death. Each type of trauma was estimated to be a few weeks apart because of the identified healing, so it was presumed his occupation was soldier. This guy just would not die. I wish I could see the rest of his skeleton. Pathologist medical examiner here, to offer a slightly different answer. Sometimes the most interesting thing isn't in the body itself. I often find suicide notes very interesting. They can be at turns insightful, cruel, hilarious, and/or poignant. My uncle instructed us not to cry, but rather read Plato's Symposium if we wanted to connect with him. I never met him, but I think of those words every single day. Worked in a pathology lab. A woman had abdominal pain and some bleeding in the nethers. Decided to go for a hysterectomy. There was a plastic spike going straight through the uterus. We had no contact with her, just did the dissection. So I have no idea how it got there, but it was pretty freaky. Medical student, I'm afraid, and it was interesting for us at the time but it might not be that great for anybody else. When we were dissecting the large intestine of our cadaver, by far the least pleasant part, we came across several little red pills amongst the fecal matter. We were too far up the intestine and they were the wrong shape entirely to be suppositories, but too far down for them to really be oral medications. In the end we decided that they were tablets the poor guy had been given just before his death and his body had already been shutting down and never dissolved them. But it was very odd to find them and none of the tutors had seen it before. There was also the time in high school when we had a rat to dissect. They were supposed to have come from a colony of all lady labrats. Ours was indeed a lady rat, but she had definitely encountered a boy rat at some point in the recent past. And that is the story of the unexpected rat fetuses. In high school I had a science class that was right next to the AP biology class. The AP biology students got to dissect cats every year. Well, somebody's cat was apparently pregnant. They brought the cadaver into our class to look at and they lined up the dead kittens on the back counter. Our teacher made us all go look at them. I did not take AP biology the following year. I worked as an autopsy assistant for 2 years while stationed in Okinawa, Japan, working under medical examiner, and probably the weirdest thing was a 16-year-old girl dead on cough medicine. At the time you could buy it out in town with codeine in it, and her liver was twice the size of adult males. I had to hold it and it took both hands and it was really heavy. I don't remember what the doctor said the cause was, but when he made the Y cut it flopped out. The girl was chubby. We just thought it was gonna be fat. I worked at a forensics toxicology lab and I found a liver that smelled like cinnamon. The livers were the worst smelling things we got, but this one smelled like someone OD on Fireball. PA working in pathology for 30 years. I've seen it all. Did an autopsy on a hiker partially eaten by a grizzly. Then did the autopsy on the grizzly suspected of eating said hiker and found tissue and clothing belonging to the hiker. Yes, I have weird dreams. SHHH. Like this video, but quietly so you don't wake up the sleeping papa. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.